Given the spread of this now, how concerned are you?
Look, I think everyone should be concerned about this particular cluster. Obviously, we now know how it was caused, which is that passenger transport driver from Sydney Airport. But I think the fact that we don't have it yet under control, and New South Wales Health is working, overtime to try and identify potential people who may have been impacted by the transmission of this virus, I think is really concerning. Obviously, we've been able to lock down the northern beaches, but you can't lock down Berala.
Well, yesterday, the Deputy Premier said that there will be no lockdown at all. Do you think if the situation escalates, would a localised lockdown be appropriate, like what we saw in the northern beaches?
No, I don't think you can do that. I think in the northern beaches, people generally stick to that area, and it is rather isolated. But I don't think you can do that in Berala, because people obviously move around that area and into southwest and western Sydney. We support what the government is doing, which is doing everything possible to avoid a greater lockdown of Sydney. But if you were to look at any lockdown, I would think it would have to be a greater Sydney lockdown, and no one wants that right now. So I think, locking down Berala, which is where this cluster is located, not where transmission is necessarily occurring, would be impossible.
Now, you've raised concerns that the health advice isn't reaching everyone in Berala because of language barriers. This morning I spoke to the Cumberland Mayor. He said that letters are now being sent out to everyone in 5 different languages. Do you think that this potential delay could be costly?
Look, I think it's important. New South Wales Health, I've raised this with New South Wales Health a number of times. New South Wales Health has been great in translating advice sheets. So, what is COVID, how you protect yourself, how it's transmitted. I think it's a very different approach if you need to reach people to say you need to get tested right now. So I'm pleased that Council is doing that. I know that the local member, Linda Volts, is also now working overtime to get that information distributed. But, I think it's really important to understand that some people don't have English as a first language, particularly older folk, and we need to make sure that we're reaching everyone. So, good on Council, good on Linda, and I would hope that Health realises that information needs to be put out in different languages, particularly when you're talking about Western Sydney.
The SCG test has now been decreased to just 25% capacity. Is that appropriate still, that it go ahead even though it is at a reduced number?
Well, I think people know our view. Our view is that while this Berala cluster is not under control, that we shouldn't be having the SCG test with crowds. We should definitely be going ahead with a test, but not with a crowd. I'm concerned that only in the last couple of days Health has become involved in ensuring that the proper protections are in place for the cricket. Obviously, before the Premier went on leave, she announced that Health would be doing a walkthrough with Venues New South Wales. But it appears that yesterday information had been given to the government on how to manage this safely and more appropriately. I think today, when the Deputy Premier does his press conference at 11 o'clock, it would be good for him to actually reveal what information was given by Health, that is, what advice was given by Health, to make sure that the test can go on in a safe way. The fact is that we need to keep the economy open. We absolutely support the government's approach on this. They say that holding the test is about jobs. Our view is that sometimes you have to make these difficult decisions if you are to keep the whole economy open, which brings us to where we actually began, which is making sure that we don't have a greater lockdown of Sydney when we have an uncontrolled cluster.
And in terms of mask wearing, it's something that Labor has been calling for a while now, to mandate it. We now have a mandatory mask mandate indoors. Does that go far enough, do you think?
Yeah, look, we're really happy with what the government has done. We would have liked to have seen that earlier. And I think the BWS Woolworths cluster is a good example of that, because if you have people who are wearing masks at that particular time, the likelihood of transmission has been, would have been significantly reduced. I mean, I'm coming to you from Burwood this morning in my electorate. I was doing my supermarket shopping yesterday, and I can tell you that everyone within Burwood Westfield and the supermarket I went into, they were actually wearing a mask, which was was terrific. I didn't see anyone that wasn't wearing a mask. I think people have accepted this. I think people know that this is how you keep the economy open and people in jobs, which is by making sure that every single protection is put in place. And by that, you know, that's the washing of hands, it's the use of sanitizer, it's the social distancing. I mean, there's the four-pronged attack, which health has been, very, they've reiterated a number of times about how you make sure that transmission is reduced. And I think that masks are an important part of that armoury. So we're really pleased the government has moved down this path. I think that it would have been better to see this earlier, and as I said, the Berala situation is a good example of why this is needed. But, good on the government for moving down this path, and we fully support what they're doing.
Yeah, good to see people wearing the masks as indicated. Just finally, we are seeing testing numbers fluctuate, but they're certainly not at the levels that New South Wales Health would want. What would be your message to the community?
Yeah, look, we saw 22,000 yesterday. I think we need to get that up, and we need to be focusing on that. Those people who obviously visited the bottle shop and visited Woolworths. I think that, when you've got, your sort of first line of tests, which people know that if you visited the bottle shop, if you visited Woolworths, you should get tested. And I know that the government has actually expanded the window with the supermarket there this morning. But I think it's really important that the community understands that, you need to be tested. The slightest symptoms, you need to be tested. If you went into one of those locations, you need to be tested. But again, it comes back to the fact that that's a hugely multicultural area, and I do think that government needs to act quicker in these areas to get that message out in different languages. As I said, I congratulate Council, I congratulate Linda Volts, the local member there, because they're doing the work, I guess, that Health should be doing. But we need to get those testing numbers up. It's critically important that those testing numbers are up. And it shouldn't just be in that Berala area, because, we mentioned that you can't shut down Berala because it actually spreads around southwest Sydney and western Sydney far more potently and aggressively than what it would in the northern beaches. So, I would encourage anyone in southwest and western Sydney to get tested if they feel that they have the slightest symptom.